I'd now like to come to our chairman of today's program, and I would like to introduce Mr. Bob Campbell. Bob Campbell is the president and CEO of Alliance Solutions Group, a veteran-owned business that delivers emergency preparedness, health, safety, and environmental solutions since 2005. Bob holds a graduate degree in international business and environmental engineering and has 23 years of emergency management experience. He served in the US Air Force as a bioenvironmental engineer, where he also became a certified hazmat technician. A thought leader on hazmat planning and response, Bob is a regular speaker at international conferences. We are delighted to have him as chair of today's program, and I'd like to thank and welcome Bob Campbell. Bob, if you can kindly switch on your camera and come on screen. Great, thank you.
Great, and good afternoon, and welcome to the Hazmat panel of the Fire Safety Forum. I'm pleased to be moderating this panel of experts and leading off the presentations with a short discussion on hazmat preparedness and some best practices. This afternoon, we're going to hear from a panel of experts that will share recent and relevant best practices and lessons learned from recent hazmat incidents. These are intended to stir up thought and discussion and idea exchanges that will benefit all of our participants. With what I'd like to share from my experience working in 48 states and 17 countries, including the UAE as a consultant, I'd like to share some of the best practices in community public safety and private sector facility, things that they have done to implement successful hazmat preparedness programs with the hope of just sharing these ideas. These programs really begin with an awareness and planning so that responders can assess community-wide risks, get the right equipment and resources, things like PPE, detectors, drones, other equipment, and facilities themselves can prepare to prevent and mitigate measures to ultimately reduce the risk for themselves and the surrounding community. So the presentation I'm about to give focuses on developing pre-incident plans and establishing a framework for community preparedness from some of the best practices that I've seen. So with that, I'd like to get started. I want to start by setting a few goals and laying out what I think are some goals for any successful hazmat program, and then addressing a few of the challenges. And then we'll go through some case studies and then elaborate on a pathway to setting up hazmat program. So the first goal that I would set is ultimately to reduce risk from unknown hazardous materials, because they're unknown until we know what's there. So what exists in these facilities, what's being transported across the roads or railways, and how do we reduce the risk to the community if there is an incident like a fire or a spill or an accident. It's important for first responders to have good situational awareness related to what is being stored in their community, transported, and used, perhaps even being processed. We want to create innovative ways to identify which of these facilities have hazardous materials. Some have a lot, some have a little. How does that information get collected, stored, and recalled so that if there is an incident, first responders, civil defense can access that information, be able to respond successfully. But we also want to empower hazardous material facilities to do their part, to make sure they're implementing the preventive measures and mitigation measures that are necessary in order to reduce the risk to the community and responders. And finally, we want to make sure that each community has access to a fully capable hazmat response station, whether that's 5 minutes away or 3 hours away. Each community needs to have responders that are capable and well-equipped and trained to be able to respond and recover from incidents to reduce the risk to the community. Now, it sounds good, but there are a lot of challenges out there, and every community faces these same types of challenges. So I'm just going to lay them out. One of the biggest challenges for the first responder community, civil defense, emergency managers, is that they don't always control the process of regulation and legislation to drive responders or the facilities to be able to submit information about the hazardous materials being stored. One of the trickiest places that I've found over the years is ports. ports, you have commodities coming and going, and you don't always know what's located in those ports. And it's hard to track. And even those that run the port sometimes don't even know what's coming and going. We'll see that from a few of the case studies that we're going to present today. The second is what is unknown out there. We don't know what we don't know. And if hazardous materials are being stored or processed, or perhaps new materials are being manufactured, maybe they're being transported throughout the community, or raw materials are coming and going from facilities, it's hard to track all of that. Communities really struggle with knowing what hazardous material exists, how much, and where it's located. Many communities lack the ability of having a current centralized database that stores the information related to these hazardous materials. And that's necessary for doing planning, analysis, as well as actual response. Next is the gap that exists. So once you find out what hazardous materials are being stored within your community, then you need to look at what the responders have in place in the way of personal protective equipment, detectors, PPE, their procedures, the training that they have. And there's sometimes a gap, because not every first responder department, whether it's a fire department, civil defense, police, have every capability that they need. That just is unrealistic, and no community has that. But what do they have to be able to respond to the immediate risks within their community? It might just be a plan. It might be procedures. But nonetheless, there are gaps. Those gaps need to be identified so that you can plan properly, equip properly, train properly. This leads us to this need for a comprehensive layered strategy for building hazmat response capability and capacity. That layered strategy involves awareness within the community, the plans, equipment, training, exercises, all the things that build capacity within the community. And finally, the lack of regulatory framework and inspections. And we'll see that in a few of the case studies as well. Again, these are out of our control in some cases as responders and planners, but the community has the responsibility ultimately to create zoning and districts where hazardous material and industry can be stored, and perhaps sometimes that's away from where communities and residential areas are located, and sometimes it's not. And sometimes the residential areas grow and get closer and closer to some of these areas where hazardous materials are stored. Nonetheless, those are some of the challenges that we face. I'd like to just briefly discuss, because I know some of our speakers are going to get into more details on some of these case studies, three incidents, recent incidents that have occurred that you may be familiar with that drive the need for developing a hazmat preparedness program. We'll go through Tianjin, China, Atchison, Kansas in the US, and the recent Beirut explosion in the port. Our first case study goes back to 2015 in a port, Tianjin port in China, where Ruhai International Logistics was storing tons and tons of hazardous materials. Essentially what happened in this port was one of those materials known as nitrocellulose, which is an explosive material. About 200 tons of nitrocellulose was not being stored properly. It self-ignited and led to an explosion, which led to subsequent explosions related to some of the other materials being stored in that port. And as you can see from the overhead view on the slide, very large explosion, killed 173 people, injured almost 800, and over $1 billion in damages from the materials that were being stored in that port, ultimately because of poor storage. Some of the other root causes related to this incident included a lack of regulations for handling and storing chemicals within the port. There was also some collusion between the businesses that were storing these materials and the officials that led to a lack of transparency and inspections. So therefore, the first responders were unable to prepare properly because they were unaware of the hazards that were there. That also led to some worsening during the response. As first responders made their way into this port to put out the fires, they spread water on water reactive substances, causing more explosions and more releases of toxins. Unfortunately, the fire departments involved in this response were unaware of a lot of the hazards that were located there. And while they were in the process of developing risk management plans, Rue High, this particular facility, was not in the plan because they were unaware of the types of hazards that were present there. Ultimately, a number of government agencies were found at fault, and one of the recommendations that came out of this incident was to develop a database of all the hazardous materials that were being transported and stored throughout this port. Our second case study takes us to Atchison, Kansas, the very middle of the United States. And in this small community, there was a transporter who brought a tanker truck of sulfuric acid to this facility to offload it at a processing plant. Unfortunately, when they hooked up their hose to offload this product, they hooked it up to the wrong piping system, which led to a sodium hypochlorite tank. Now we've got a strong asset and a strong base. You can only imagine what happened. They reacted. They reacted violently, and they also created chlorine gas, a cloud of not only chlorine gas, but other byproducts that drifted throughout the neighborhoods. It injured over 140 employees and responders and residents. Some of the root causes related to this incident were several human factors: unfamiliarity with the mechanism of offloading and not following the procedures. Our third case study happened just this past year in the Beirut port. There was what we would call frustrated cargo, about 3,000 tons of ammonium nitrate that had been left in a shipping container since 2013 and was being stored in a warehouse. Unfortunately, a spark perhaps generated this explosion and detonation, which ultimately killed over 200 people, injured 5,000, and significant damage to the surrounding community. Some of the root causes involved here, again, were just a lack of transparency of what was being stored in the port, and perhaps lack of awareness of keeping sparks away from areas where hazardous materials were being stored. Again, a lack of a legislative process and a way of dealing with this material was part of the root cause in this case. I want to shift gears and talk about some of the best practices in hazardous material preparedness and submit that there are 4 critical elements to being prepared for hazardous material response. The first is that regulatory framework that I keep mentioning that not only engages the hazardous material facilities, but also the responders in the community and the public, such as those that might be vulnerable if an explosion were to happen or a release happened in their community. They need to be well prepared. Second is having some type of online secure database where all of this hazardous material information can be collected, stored, and perhaps analyzed in a geographical information system, like a mapping system shown on our slide here. Once all this information can be collected, responders and planners can do plume modeling and explosive modeling, things like that, so that they can analyze, are there any vulnerable facilities within the area? They can document how much is being stored, where is it being stored? Are there any critical infrastructure facilities that would be affected? Things like pipelines, other manufacturing plants perhaps, or drinking water sources, drinking water treatment plants. Third is development of pre-incident plans. And I know this is in the title of my presentation because ultimately I think this is the end product for our audience, first responders, civil defense, is the development of a pre-incident plan that documents essential information like contact information for the facilities, perhaps some of those plume modeling and explosive modeling products, as well as some knowledge about what capabilities might exist at that private facility. And then finally, fully capable hazmat response stations strategically located and equipped. Those 4 things I think are some of the best practices that could be implemented in any community to be able to be prepared for any type of hazardous material incident. So how do we get there? Well, I'm going to submit 7 steps here in how do we get there and how do we prepare. The first is raising awareness among hazardous material facilities. This could happen through a short presentation, awareness campaign. It could occur through websites and other types of materials to create awareness among this community about the hazards that they're storing or transporting within their community and what they need to do as a responsible citizen, responsible business to be able to protect the surrounding community and manage their materials properly. Part of that involves collaboration, perhaps with the local community and first responders, to ensure everybody knows their role if there was an incident and how to protect the public. The second is, again, this is a bit out of the hands of most of the first responders. However, it's important to collaborate with legislatures to be able to have the right regulatory framework in place to be able to collect the information. Perhaps this is something that could be done upon license renewal or permit renewal for the facilities. And as part of that process, reporting back to the civil defense or other first responders about the types of hazardous materials that are located in that area. Of course, this would need to include things like establishing a threshold for reporting, perhaps an online form that would allow ease of access and transmission of that information that perhaps could even interface with a database and a GIS platform so that first responders have readily access to current information. Another part of that might be training those facilities on what their responsibilities are. And then finally, establishing requirements for those facilities in case of a spill. What are they doing to prevent spills, control their spills, and mitigate any kind of release that might occur at their facility? Now, the third step, this gets into the realm of hazardous material planning, and it would include any kind of first responder, police, civil defense, maybe medical agencies that would be involved in some sort of first response like EMS. And the idea is to take this data that gets stored in one location or gets reported to the community and regulators and do some analysis with it. So you can see on my slide, I've got an example of a plume model. This is actual incident planning for a transportation incident. So if hazardous materials being transported throughout the community, those routes are identified. We do plume modeling to be able to identify areas that might be affected. We do explosive modeling, evacuation modeling, and look at what facilities might be in that area that could be affected in populations. Part of this process leads to pre-incident planning. NFPA has a standard for how to do pre-incident planning. That certainly is a good start. However, it may not include all of the information that you as a first responder might want on a pre-incident plan. I know that in Dubai, for instance, there's a move to put QR codes on the sides of facilities. I think that's a great practice. In the US, we recently did something like that on some of our hazardous material trains, so the first responders could scan the QR code and identify what hazardous materials were being transported. Contact information, so critical and important, especially for after hours. Incidents don't typically occur during the middle of a day. Sometimes they do, but if they occur after hours, being able to contact an emergency point of contact and know what's in that facility, who could go in and do what type of response, that's important information, especially if they have their own response capabilities or resources located at that facility. Looking at what the impact of those spills and releases might be. Sometimes that spill could go down a drain and get into a waterway. It could contaminate the environment, or it could be released into the air, posing a downwind hazard risk for any of the community in the area. And finally, we like to recommend putting an action plan. We call it a pre-incident action plan in place, so that when you show up on scene and you see that there's an incident there, you know what the first 3 steps are to being able to respond to that incident, whether that's where you're going to stage, what PPE is needed to even get close to the incident, or if evacuation just needs to occur for a downwind hazard that may be very toxic. The 4th step in planning is identifying vulnerable facilities. And this could be vulnerable populations or facilities that are within the hazard area if a hazard were released into the air or into the environment. You can see my graphic on the right side of my slide there. I've got an orange circle around a blue X. The blue X is the facility. The orange circle is the downwind hazard area, depending on which direction the wind is blowing that day. The red dots are those vulnerable facilities. These could include schools, hospitals, high-rises, apartments, labor housing, or other industrial facilities that could be affected and need to be notified immediately if there's any kind of hazardous material incident at this facility with the blue X. You might also include critical infrastructure, power companies, water suppliers, police departments, civil defense stations, government facilities, oil and gas infrastructure. Anything that could be affected and is critical to day-to-day operation and continuity of government. The fifth step in the process is, now that we've identified our hazards and risks, we need to take a look at how well prepared our first responders are, the police, civil defense, and EMS. What capabilities do they need? What PPE do they need? Detectors, decontamination stations, other resources. What level of training is required? Is it just awareness level training on what to do when they roll up on scene and how to protect the people that are there? Or is it doing offensive operations, going in and turning off a valve or plugging a leak? The first responders need to have a certain level of capability, but every first responder doesn't need everything. They need something to be able to respond, and it needs to be prioritized based on risk and a layered strategy within the community. That leads us to the next step of building those hazmat response capabilities. And this includes everything from pre-incident planning that I mentioned before, which could be perhaps pulled up on an iPad or a binder. Once you roll up on scene, you'll know exactly what's there. It could also include purchasing equipment and having a modernization plan to keep that equipment current and calibrated and functioning. Training and exercises programs are really important because they bring together both the public sector responders and the private sector businesses that own and operate these hazmat facilities. And then finally, just bringing other stakeholders in. So if there is, for instance, a hospital that's within a vulnerable area or downwind, that hospital should know that they are in that area so that they can develop plans to either turn off their ventilation system, shelter in place, or evacuate. Finally, the last step here is localize and sustaining those capabilities. Once we build these capabilities, whether that's developing a plan, training our first responders, having exercises, all of that needs to be sustained. Plans need to be updated because hazardous materials change year to year. We find in many communities, new commodities being transported throughout the community, new businesses starting up and bringing in new hazardous materials. All those things need to change. IT infrastructure, if for instance, communities have an online database, that accessibility is based on whether or not the computers have access to it. So operating system maintenance, software updates, all of those things are important. And then continual outreach to those facilities to help engage them and ensure that they know their responsibilities, they know what the risks that they present to the community, and that it's a privilege to be able to store and operate their facilities in that community, and they need to be responsible citizens. So I'm going to wrap up just by summarizing those 7 steps as a method to getting to what I would call a best practice in hazardous material preparedness. The first is raising awareness among those hazmat facilities of their responsibilities to both report and plan for different types of incidents. The second is having a regulatory framework that requires these facilities to be able to participate in the community and share information with the first responders that may be involved, hospitals that may end up receiving and treating patients from an incident, as well as any facilities that are in the area. Third, gathering that information and doing something with it. Information alone may not be helpful unless we can make sense of it. So we need to do some type of analysis with that information so that we can plan appropriately and determine where our vulnerabilities exist as far as vulnerable facilities and populations, where the gaps are in our own hazmat preparedness, so that we can then build response capabilities and capacities and ultimately localize and sustain that. That is the end of my presentation.